Welcome to myacademy.com. I'm Professor Mahfooz from Pakistan. 9, which is about the ptosis and its management. Possible questions. Possible question is, what is ptosis? So you have to recognize the ptosis. What are the causes of ptosis? You need to divide it in between congenital and acquired. And what are the operations performed for the ptosis? You have to enumerate different operations and whether they are done for the mild, moderate, or severe ptosis. So let's study them. First of all, we'll try to differentiate between entropion, ectropion, trichiasis, and ptosis. En for entropion and In for inward. So entropion is inward turning of the lower lid. It may be lower lid, but most commonly it is the lower lid. So entropion is inward turning of the lid, while the trichiasis is in inward turning of the lashes. So here only the lashes are turned inside. So this is trichiasis, and if the whole lid turns inside, that is entropion. Ectropion is outward turning of the eyelid. So here the lower eyelid has turned out, so this is ectropion. And finally ptosis, droopy lid. Look at the lid here, is droopy as compared to the other eye, and this is called ptosis. And in these MCQs, we'll only discuss the ptosis to start with. Let's first recap what we discussed. Ptosis can be congenital or acquired. Congenital because of the maldevelopment of levator muscle. Acquired is 4 types. Involutional is because of the weakness or disinsertion of levator aponeurosis. Neurogenic is because of third nerve palsy. Mechanical is because of the increased weight of the lid, and muscular is because of the weakness of the muscle caused by myasthenia or muscular dystrophy. And now we'll discuss the treatment, and the next few MCQs will be based on the treatment or management. Management is medical management and surgical management. Medical management is the treatment of the underlying disease like myasthenia, or if an abscess is causing increased weight of the upper lid, we can treat it with the antibiotics. So that is the medical treatment, which is not very common because the most common causes of ptosis are involutional and neurogenic, and the treatment is mostly surgery. First of all, treatment of the tumor causing the ptosis is not a very common for a tumor to cause the ptosis, but whenever it is, you can treat the tumor, or you can drain the abscess at times, and that can resolve the ptosis. Most common is involutional, and involutional can be mild or moderate to severe. Mild ptosis can be treated with the procedure called Fascinella's Servet procedure. Mild to moderate, which is like 3 to 4 millimeter ptosis with good levator function. Remember, moderate to severe ptosis with good levator function can be treated with levator resection or levator reinsertion. On the other hand, moderate to severe ptosis with poor levator function is treated with bro suspension, also called sling procedure. So the next few MCQs will be based on this. Mild ptosis, Fascinella's Servet, moderate to severe with good levator function, levator resection or levator reinsertion, moderate to severe with poor levator function with the bro suspension. So let's start with the MCQs. Thank you very much for being with me, and please do give your feedback. Thank you.